When the coronavirus broke out in China, the surveillance state went into overdrive. Thermal scanners were installed in train stations. A color-coded surveillance app tells citizens whether they can leave their homes, and millions of security cameras revealed who was breaking quarantine. Many deemed the lockdown and surveillance measures draconian, but ultimately successful. The outbreak was largely contained to the Hubei province, and after 76 days of quarantine, the city of Wuhan is starting to open back up. It's highly unlikely that we'd go that far in the US, where our values and our laws call for greater individual liberties.
The DNA of this country is heavily libertarian enough that would just be a non-starter. But could I imagine small incursions here? Possibly. Do I think it's necessarily a bad idea? I don't know. I think I need to see the details of implementation.
Researchers and health officials in the US are scrambling for more comprehensive and granular data, raising the question of what kind of personal information we should collect in a time of crisis. So far, the severe lack of testing, as well as our decentralized healthcare system, has made it hard to understand the true scope and spread of the disease.
All the modelers are working to some extent in the dark when it comes to knowing how many folks are already infected or have been infected and recovered.
So in the meantime, we're being told to stay home, and many are still wondering what it will take for life to return to normal. Apple and Google say they can help. The tech giants have teamed up to build a tool that will alert smartphone users if they've been in contact with someone who has coronavirus. This is called contact tracing, and it's helped a number of East Asian countries to slow the spread. For it to work, though, the public needs to trust that these tech companies won't be able to access or misuse their sensitive health information. And while what's been proposed is an opt-in tool, concerns swirl that it could eventually become mandatory, and that it will prove difficult to roll back data-gathering efforts after the crisis passes.
In times of emergency, we tend to be willing to give up much more of our privacy than in normal times. But once given up, that new status quo tends to persist even after the emergency is over.
But as we try to get our economy up and running again, a sophisticated contact tracing tool could be a major part of the solution. The United States has been slow to aggregate comprehensive data about the crisis. One reason is simply a lack of widespread testing. Narrow testing criteria, along with a series of delays and missteps in the test development process, made it impossible to measure the extent of the pandemic early on. Another reason is the United States' decentralized healthcare system, which gives states the power to decide what data to gather and release and what to withhold.
Many states have in turn delegated a lot of their authority to individual municipalities. What that means is essentially that you have decision makers that are more diffuse than in other countries.
So much of what we know about the clinical outcomes, severity, and risk factors for COVID-19 comes largely from data that were published in China as the epidemic unfolded in real time.
Even with 95% of the country under stay-at-home orders, experts say a lack of reliable data can leave citizens confused about what actions to take, especially since most of us are still leaving sometimes, whether it's for exercise, groceries, or essential work.
People are making all sorts of individualized decisions about how seriously they're taking that advice, and the availability of this information, including trend lines, might allow them to make the best of these choices they can.
It's a question of, do I want to know, or should I know, that the street 2 streets away from me, every single person on that street's infected, but 2 streets on the other side, nobody is. Information is power. It's empowering to understand what's going on around you and how it's happening.
But even knowing more granular location and demographic data may not be enough to stop the spread. The prevalence of pre-symptomatic and asymptomatic carriers means that those hypothetical neighbors on the other side of the street could be infected too. They just didn't see a reason to get tested. This is where contact tracing becomes important. Contact tracing is a simple concept and an old concept. Public health departments usually implement it in the early stages of an epidemic.
And the traditional way that they do this is by interviewing the person, and they ask them where have they been, who has been to their house, where do they work, and so forth, and then they just start making calls.
China, Taiwan, South Korea, and Singapore have all instituted some degree of technologically enabled or analog contact tracing, which many credit with helping to slow the spread. In many cases, these efforts were aided by mass testing, more centralized universal healthcare systems, and numerous other surveillance measures, many of which would not pass muster in the US. The Chinese government's Close Contact Detector app tells users if they've been in proximity to someone who's confirmed or suspected of having the virus, but it makes no attempt at privacy. Users sign up with their full name and ID number, and if they're marked as contagious, the government gets all that info. To identify contagion risks, China relies upon its vast surveillance infrastructure, which includes security cameras equipped with facial recognition software and a social credit system that tracks all citizens' behavior.
If we tried to transplant the Chinese system to the United States, people would be up in arms and likely would be much less efficacious.
South Korea and Taiwan have also managed to flatten the curve, while avoiding widespread lockdowns like we've seen in China and the US. In South Korea, the government uses cell phone location data, video surveillance, and credit card records to monitor activity. And if a citizen tests positive, an emergency alert is sent out that includes their last name and a detailed record of their everyday travel. An app monitors quarantined individuals to make sure they don't leave home.
And the government's now working on getting monitoring bracelets on people who go into self-isolation for 2 weeks.
Similarly, Taiwan uses cell phone location data to maintain an electronic fence around its roughly 55,000 quarantined individuals, which alerts authorities if anyone strays too far.
The country actually passed enabling legislation on a very rapid basis, literally a matter of days, to permit the government to do a variety of things that it wasn't clear they were able to do under existing law, and cabined in that government authority to this time of emergency.
But perhaps the country with the most realistic model for the United States is Singapore, which has rolled out its own contact tracing app to complement intensive analog efforts on this front. That is, lots of person-to-person interviews.
An app called Trace Together that users can choose to install and that will ping off surrounding phones to let them know if they have been in contact with a case. And then only if it pings and lights up a contact are public health authorities alerted to the data.
Additional measures the country's taken, like requiring quarantined individuals to verify their whereabouts multiple times a day, would likely not fly in the US. But overall, Singapore's swift and disciplined response was highly lauded. Until mid-March, there were only a couple hundred cases, and citizens were still going out for work, school, and leisure. But now, cases are surging, and the country went into lockdown at the beginning of April. So if even Singapore couldn't contain the virus, many are wondering what kind of response will it take? Enter Google and Apple, who are teaming up in an unprecedented partnership to create a contact tracing tool of their own, with much the same premise as the Trace Together app. The two companies' operating systems, iOS and Android, power nearly 100% of the world's smartphones.
It's absolutely unusual for Apple and Google, these two cutthroat competitors, to join forces. They're the only two companies in the world that could do this, right, as the two major mobile phone technology providers. If we're going to do Bluetooth proximity tracing, it has to happen at the operating system level. And Apple with iOS and Google with Android, they're the ones who control that.
In mid-May, Google and Apple plan to release a tool through an update to their operating systems that uses Bluetooth signals to log when a user's smartphone comes into close contact with another user's phone. Then, if someone tests positive for coronavirus, they'll use an app to share that information, and their phone will send out an alert to all the other users it's come in close proximity to. Individuals using the platform will be assigned a random and ever-changing identification key to ensure anonymity. The idea is that Google and Apple will build the infrastructure, and public health agencies will build the apps themselves. A number of efforts are already underway, including an app called PrivateKit Safe Paths, being developed by the Massachusetts Institute of Technology. The companies emphasize that these apps will be 100% opt-in, and that governments will not be allowed to mandate usage. But to actually do contact tracing effectively, they would need to get massive buy-in from users.
Yeah, I think it's pretty clear that if only 5 or 10% of the U.S. population opts into this app, it's going to have very limited efficacy. Now, in a place where I live, like Silicon Valley, we'd probably see very high levels of participation, but in other parts of the country, you probably see virtually zero participation.
As of mid-April, about 20% of Singapore's population had downloaded the Trace Together app. But to stop the spread of the virus, the country's development minister said 3/4 of the population would need to use it. Another contact tracing research group put the figure at 60%. Either way, it's hard to imagine this percentage of the United States population opting in, especially when you consider that according to the Pew Research Center, only 81% of Americans even own a smartphone at all. And those who don't are often among the most vulnerable.
So we're leaving out elderly people, we're leaving out homeless people, we're leaving out people who are living in poverty, might not have consistent access to electricity or to Wi-Fi, and we risk undercounting and underserving those very people who need those resources the most.
But even if lower usage rates couldn't achieve comprehensive contact tracing, some say these tools could still reveal powerful insights that might help limit widespread shutdowns.
If in general, over a population, there's 10 to 15% penetrance of adoption, then we'll actually have a good understanding of a good amount of exposures. By knowing that and actually applying data science to that, you can actually create extrapolations, probably the overall map density of infected individuals and potential exposures.
There's certainly a lot that remains unknown, but experts agree that a digital tool can only ever be one part of a larger solution, which would include traditional contact tracing interviews, as well as widespread testing. The biggest hurdle of all, though, may be getting a critical mass of users to trust these companies with their data. Over the past few years, big names in tech have regularly made headlines for privacy violations, such as storing users' location data even when they've supposedly opted out, as Google did, or using deceptive settings and statements to undermine privacy preferences, as Facebook did.
It's true that this app is being developed at a time where there has been greater distrust of big tech.
Gebhardt says that's why, if digital contact tracing is going to work, the companies need to be 100% transparent about what data they're collecting, how they're using it, and when that data will expire. So she doesn't see the opt-in system as a hindrance. She sees it as a necessity.
Trust is going to be at the core of this. It can't be coerced. Coercion is going to make people want to get around it, avoid testing, avoid treatment. It's important that you be able to turn it off and turn it back on when you want. I think that's another thing that might help adoption.
But some would argue that a voluntary app, intermittently used, could never achieve its goals. Even if the companies say they never allow it, Mello says she could imagine government-mandated adoption holding up in court.
The government would have to show that the steps it was requiring are necessary to combat a public health threat and reasonable. They also need to show that there's no less burdensome or invasive way of getting this information, and I don't think that's a very difficult showing to make at this point in time, given the prevalence of the virus and the asymptomatic spread.
Another concern is what becomes of this contact data and health data after the coronavirus crisis passes.
What I would like to see are commitments towards de-identification and ultimately data destruction. So even if we are sharing data, it should be held for limited purposes and for limited periods of time.
On this front, though, the U.S. doesn't have a great record.
My fear is that we're going to adopt new surveillance powers and that they wouldn't go away after the crisis is over. I think that's one of the most important things. And we've been here before. After 9/11, the United States instituted mass surveillance, and we're still talking about that in the courts today.
Big changes that we make now, even if in theory temporary, have a tendency to become sticky.
Basically, proceed with caution seems to be the general sentiment among privacy advocates as Google and Apple move forward with their development process, and as researchers and governments alike look at how else to aggregate and utilize data during these uncertain times.
We are going to have other times when this happens. Hopefully it's 100 years from now, but maybe it's 50, maybe it's 20. And having the digital tools and understanding how we can prepare by minimizing the economic impact, but maximizing the health benefit is going to be important.
And while we should always strive to minimize risks to individual privacy, some say we also must consider what we risk as a society by not aggregating and sharing the data that we have.
So there is a real trade-off here, and we have to think not only about the burdens on individuals from using these data, but also on the burdens from not using these data, which might include greater spread of the infection and greater persistence of shelter-at-home orders for all of us.
Few would argue that we should go the route of China, but as headlines heap praise on Singapore, South Korea, and Taiwan's more stringent and surveillance-intensive methods, it's clear there's an appetite among some in the U.S. for a more heavy-handed approach. Gebhardt, though, says deciding between privacy and public health is a false choice.
We want to make sure that whatever we're building or using to address this pandemic, that when we come out the other side, it's a world we still want to live in. I think whatever technical solutions we put forward as the solution right now, we don't want them to become tomorrow's problem.